COVID-19 is spreading rapidly in Dallas County. The data is clear. Our case numbers and our hospitalization numbers, which we've been tracking daily, are headed in the wrong direction.
That is the mayor of Dallas talking about a sharp increase of coronavirus cases there. That's just one example of the bigger picture. The number of COVID-19 cases surging to more than 38,000 in America yesterday. That is a record daily high. It surpasses the previous record that was set 2 months ago. So it's time for our headliner, Health and Human Services Secretary Alex Azar. Mr. Secretary, good morning. Welcome back.
Great to be with you. Thank you.
What's your plan?
So we're working aggressively with states and local leaders in this situation, but it's important for the American people to know this is a localized situation. The counties that are in hotspots are 3% of American counties. Now, that's not to minimize the situation. It's really important that we get to the bottom of why we're seeing the surge in cases. Now, some of it clearly has to do with increased testing. We've tested over 30 million people, 3.5 million just in the last week. And the average age of people testing positive is going down dramatically. That means we're capturing younger, asymptomatic individuals, which is a sign of a very robust testing system that President Trump has delivered. But we also need to get to the bottom of why we're seeing such spreading. So we've deployed teams to the county level to work with local leaders and community leaders to figure out why we're seeing this kind of spreading.
You know, Mr. Secretary, thanks for being here this morning. People want to know first and foremost if they're going to be safe, obviously. But if they haven't returned to work, they certainly want to. If they're back at work, they want to stay there. And they want to know if their kids are going to go back to school in the fall. Do you see another shutdown happening?
I don't, although you'll see local community mitigation steps depending on circumstances. You know, as I said, the hotspots are in 3% of American counties. About 110 counties right now are the ones that we're focused on. We can get back to work, back to school, back to worship, and importantly, back to health care if we act responsibly as individuals, if we keep in mind what are our individual vulnerabilities. You know, most of the fatalities in severe cases are in individuals who are 80 years or older, or 65 years of age and older with 3 comorbidities such as diabetes, obesity, renal failure, lung disease. These are the people that have to be really protected, ring-fenced, protected. The rest of us obviously should take sensible precautions. None of us want to get this disease, but we have to protect those individuals. We can get back to work. We can practice social distancing. We can wear face masks if we can't practice social distancing.
But, Mr. Secretary, we certainly appreciate you being here, and you're talking to our viewers. You're trying to get out there and be transparent with the nation, but you haven't had a coronavirus task force briefing in a long time, several weeks, as you know, from the White House. And at the beginning of this crisis, it was very important for the president, the vice president, and yourself to deal directly with the American people. I've heard you now in this interview say it's a localized problem. To Sandra's question about schools, it's local. I get that that happens on the local level, but are you kind of farming this out now to local and state governments?
No, not at all, but it's always a locally led, state-supervised, federally supported process of responding. And you've heard the president, the vice president, myself. We've got Dr. Fauci, Dr. Birx, Dr. Redfield. In fact, the 4 doctors just spent 7 hours testifying before Congress this week. So we're out there, we're keeping the information flowing to the American people, and we're supporting our county and state leaders to deal with this with transparent information and giving them the support that they need.
There's a piece in the New York Times this morning, Trump's feeding America's coronavirus nightmare. Secretary Azar, I'll read it to you. We need a Churchill to lead our nation against a deadly challenge. Instead, we have a president who helps an enemy virus infiltrate our churches and homes. Churchill and Roosevelt work to deceive the enemy. That Trump is trying to deceive us. What do you say to that the president's leadership through all this and now talk of a potential second wave, that we could be doing better? How do you respond, Secretary Azar?
Listen, these kind of partisan attacks are just completely irresponsible as we're in a pandemic. We're all working together. The president, the vice president, and I, we're working with governors and local leaders, regardless of party, to work for the benefit of the American people here. And thanks to the president's historic leadership, we have the tools to deal with this. We have surveillance. We've got historic testing systems. We've got containment at the local level. We have hospital system capacity and supplies for them. We're bringing therapeutics to market. We're developing vaccines at record speed. That's all thanks to the president's tremendous leadership pulling not just a whole of government approach, but a whole of the American economy approach together on this. He deserves credit for that, as well as the complete transparency that he and his administration have provided throughout this crisis.
Mr. Secretary, we have got about 30 seconds, but on the vaccine question, you seem to be showing some optimism. And Dr. Fauci and others said it's not a matter of if, it's a matter of when, I guess is the way they were putting it, that they're very confident that at least early 2021, we're going to have a vaccine. How optimistic are you, sir?
I am optimistic given the president's leadership here. We are devoting tremendous resources to ensure that we reduce any unnecessary delay in developing a safe and effective vaccine, but also importantly, we're manufacturing hundreds of millions of doses of vaccine at risk so that they'll be ready if a vaccine is approved by the FDA. So tens of millions by this fall, hundreds of millions by early next year.
Okay. Thank you for your time.
Secretary Azar, if I could just a final thought on just the second wave. We're listening to you talk about the vaccine coming in January. Obviously, the flu season could come in. We all want to get our kids back to school safely. Do you see that second wave happening? What does that look like, Secretary Azar?
So I don't think it's useful to talk about first wave, second wave. We just need to deal with the epidemiology on the ground. Right now, we've got 3% of counties that are presenting with rising cases, and we want to deal with them. And we use those 6 tools that I talked about: surveillance, testing, containment, health system resilience, therapeutics. We now have 3 therapeutics we're working with. We've now got remdesivir. We have convalescent plasma. We have steroids, and we're going to keep bringing other products like monoclonal antibodies to market, so we can keep reducing our fatality rates. You know, any death is too many, but we now have fatalities in the United States for over 16 days below 1,000, and our rate of fatality per million puts us at the top tier of developed countries around the world in terms of performance there and protecting our vulnerable people.
Okay. Secretary Azar, thank you.
Thank you.
Thank you.